I miss everything.
In a country that is called a country of dreams. So when I reached there, I said, oh my gosh, my dreams are coming true.
I'm a graduate from the University of Rwanda. I graduated in 2018 in biology department, but I did an option of botany and conservation. I'm currently working with an agricultural non-government organization called Waneka Fund, where I work as a recruitment coordinator. So I live with my mom and my two brothers. I think memorable experiences started the day they told me I was going to go to the US for this fellowship. The first thing that came in my mind was like, oh, am I going to get lost on the airports? Because I didn't know I was going to travel with a lot of people. But when I got to the US, everything was brand new to me. Like the environment, the cities and everything was really new. And I was so curious to learn about everything around me, like to learn people's culture and people's, daily activities. So there's something that stayed in my mind, like really that helped me a lot. When we got there, there's a book we shared as One Health Fellows and students from Tufts. And this book is called Foreign to Familiar, I guess. So this book helped me to learn about people's cultures and how I should behave if I'm not in my own country. And it actually stuck in my mind to the point where every time I meet new people, I first need to pay attention, know their culture, know what they expect from me and how to behave around them. So this book is really a strong memory that has stayed in me, and I keep remembering it every time I meet a number of people from different cultures. Like where I work right now, it's an international organization. We work with different people from various countries with various backgrounds. So this is something that has even helped me in my current position at Waneka Fund. So it's a strong memory that I'm not going to forget.
I'm a communication dispatch team leader at the Ministry of Health in Rwanda, and I'm part-time journalist working for Flash Radio and TV broadcasting. I'm actually strongly grounded in media and communication, and I hold a Masters of Science in Mass Communication from Jomo Kenyatta University, and a Bachelor of Arts in Journalism and Communication from the National University of Rwanda. I have a wife and a daughter. I have to say that it was my first time to the United States of America, and everything was new and unfamiliar. But I was really amazed how people are really helpful. They want to help. The people I met at Tufts University, the people I met at North Carolina State University, they are really amazing. When you look at things, the culture, the lifestyle, the academic institutions, it's everything is new. So for the culture, I was amazed with the campfire when we went to the event and we gathered, we had conversations, and also around the fire. That was really a really good, stunning experience, which I really loved. And also, I had an understanding of what is One Health, how can we really how can we use One Health in what we are doing in our daily life. That was really an amazing experience, meeting different people from different backgrounds. That was something I didn't expect, and it has been life-changing.
I work from University of Rwanda, College of Business and Economics, School of Business, Department of Marketing and Human Resource. I have a bachelor's degree in business administration and a master's degree in entrepreneurship. I am married with 3 kids. It was a good experience to have this opportunity to go to the United States for One Health Fellowship. It was really a great opportunity for me. From the training, I got to understand what human health, animal health and environment, how important they are and how they are interlinked. Today's challenge, they come from either the environment and they can affect the animal or the human. Or animals can, humans as well can affect the animal. So there's a need to get a way of intervention that can cater for the three. My being in the US, I got to know that we have really different culture, whereby for us we have a hot culture, whereas in the United States it's a cold culture. So I got to know how to relate to the people of different culture. In whatever country I can go, I can know how to handle myself. By the time I reached the Assumption College, I found that they had arranged an orientation program for the new students. So, unlike in our university where students come on their own, I just came to know that when there is an orientation program, students come with their parents and they all participate in this orientation program. So it's something that I liked, and I feel like given opportunity, I can try to also apply in the university I work in that parents get to know the kind of life their students or their children are going to be in.
I hold a bachelor's degree in dental therapy from University of Rwanda, and a master's degree in global health delivery from University of Global Health Equity. Over the past 4 years, I have been working in rural areas, providing oral health services at the health center level. I'm married, I have one wife and one lovely daughter. Stepping in the US was a great experience for me because it was my first time out of Rwanda. So being in the US and the first time out of Rwanda was a greatest experience. This is based on what I experienced there. So when I reached the US, I was happy to step my feet on in a country that is called a country of dreams. So when I reached there, I said, oh my gosh, my dreams are coming true. I was also well received by the population there, people who are lovely. And also, not only that I was participating in a great program, One Health Fellowship, but also I was expecting to meet my old friend and my old teacher, Professor John Morgan, who is teaching at Tufts University. I was also happy to visit different great universities which are located in Boston City, and I had the chance to visit the Harvard University, and I was also happy to visit the hospital, which is the base and hold a great history for the project called the PIH. So that hospital is Brigham and Women's Hospital. I was happy also to be a One Health Fellow and at Tufts University Dental School, which is well recognized worldwide to train great dentists in the world. So that was a great experience for me to be in the US, but especially in Boston City, a city which has great universities, as I mentioned already.
I'm working at the University of Rwanda as an assistant lecturer. My background is nursing, specialized in education, leadership, and management. I'm teaching in undergraduate and also I'm co-teaching in postgraduate in nursing. I'm married and I'm having 2 daughters. Oh, it was amazing to be there. It was my first time. I got exposed to a lot of new things, including the culture. The culture was amazing. Also entertainment activities that we had there. We went to the Boston Harbor. We went to the lake when I was in Minnesota. We had a lot in terms of culture. I attended different parties like barbecue and other different parties, and they are very different from how we do our party. And also I learned a lot in terms of One Health approach. I got a lot of skills and knowledge which will help me in my future career development. And also I got networking opportunities I will use to improve and to grow in my career in the future.
I am an environmental health technician by background. a One Health Fellow from Tufts University, and I work in the humanitarian sector as a water, sanitation, and hygiene coordinator in Global Humanitarian and Development Foundation. My experience in the US was nice in general, but I would say one of the memorable experience was when I visited the National Aquarium in back in Baltimore. When I entered the building, I couldn't believe that it was man-made. I saw all types of fishes I did not know existed, and it was pretty impressive how they managed to put all types of fish and other animals and prevent them from being prey. That was really amazing what I saw there.
I currently work at UGHE, and sorry, my background is in biology. And after that, I went straight to work at a hospital, and then after that, I moved back to Rwanda, currently working for UGHE, University of Global Health Equity, as executive assistant to the Dean of School of Medicine, and also working part-time job with the Bridge to Rwanda as a Scholars Transition Coach, and also a One Health Fellow. When I went to actually visit the PIH office in Boston area, it was my first time visiting the office, which is what I currently work for, which is I work for UGHE, which is the initiative that was born from PIH. Basically, PIH does the more of the political side of addressing health care and health services issue, and UGHE is more of an academic side born from PIH. And so our main office, I would say that it used to be located in Boston, now officially moved to Kigali. But it was my first time visiting the Boston office, and all of a sudden I bumped into an old friend. We used to do the Bridge to Rwanda program together. She's called Ange, and so I think that was quite a surprise for me.
I'm a veterinarian. I hold a master's in veterinary preventive medicine, where I focused on a field epidemic track using organised approach. Basically, what I did is mainly outbreak investigation and disease surveillances. Currently, I'm working with the University of Rwanda, where I work in the School of Veterinary Medicine, and currently I'm acting as head of department for the Department of Veterinary Medicine. Besides on that, I have a family. I have 2 daughters and a wife. I went to US for the first time in the United States. I went to Boston. I went to Tufts University. I've been heading Tufts for so many years because Tufts Cummings school is partners with the University of Rwanda, the school where I belong. So it was my really dream to be there. So and also, I think I met new friends in the United States. Yeah, first time we went there, we were like, you know, when you feel like you're outside of your country and the continent, you always get changed with the new culture. So you like, people doesn't walk in the streets. You see them all driving, and it's not common. And people move with the animals, like pets animals, and they take they are like their friends, their daughters, sons. So, and also people doesn't like greet the way we do. So it was challenging to us for the few days, and thank God we got some good books and trainings on how do you like work with the culture, hot and cold climate culture, and then they helped us to cope with the situation we were in by that time. Well, it's a lot I got. It's like adding on the previous knowledge, but what they really amazed me that everyone now is part of One Health. I saw the role of plants in One Health. I saw the role of the engineers in One Health, in the designings, in constructions, in the water management, and I also saw the role of One Health in the food security and food safety. And besides on that, I also keep on information on how do we use technology in One Health and how do we handle disease like outbreaks using One Health approach. It's really an opportunity and the experiences I've got during the fellowship program I attended.
If you look at the lifestyle, like the food, like the way of transport, all of those things were new to me, and experiencing that thing was something new, and I think it will be helpful to me when I go back to the United States or when I go back to other countries. The most important, I have to add that I made a lot of connections, I made a lot of friends, and those friends, I think they will be very important to my future career, my future academic work, because I made people whom I tried to negotiate collaborations, and we are doing it nowadays, the researches. So that is something which will be important to me, important to my country, and hopefully to the whole world.
When I graduated from biology at the University of Rwanda, I did my internship. I did a 6-month internship with an organization that works on climate change related projects. But after that, I did not get another opportunity to go back to what I studied, and I really wanted this to happen to me. And later, when I found this opportunity, I applied, and fortunately I got it. So when I got it, I was like, oh, perfect. This is an opportunity for me to do what I love the most and to give back to my community through what I have committed my life to, because I took 4 years to study my sciences. So I'm not going to waste it, maybe doing something else. So this was an opportunity for me to start a new journey in my career and in my field of interest. So from the US, I learned a lot about One Health leadership, and I actually learned more and understood how various disciplines should come together to address One Health issues, and I of course understood my contribution as a biologist. This was very helpful, but I also understood that even if I'm not doing biology right now, even though I'm doing recruitment and maybe agriculture, so I understood how in my current position I can contribute to the promotion of One Health. I was placed at the Ohio State University in Worcester. Well, the experience was really good. Well, this experience of being placed in a place where I'm alone, I'm the only Rwandese. I did not go with my fellows. So this gave me it equipped me with a strong sense of responsibility, and it pushed me to learn every other thing alone, and to also socialize with people, because when we were still at Boston, I used to only maybe talk to Rwandese, maybe fear to talk to other guys, the Tufts students. But when I got there, I had no other option but to make sure that I talk to everybody. And something else, I was working with my mentors at the Ohio State University, and my mentors were very busy. They're so busy that if I wasn't proactive enough, I wouldn't learn a thing. So I learned to be proactive and to proactively approach people, ask them to teach me things, give me things to help them with. And I learned a lot of research on the field, because I was working on the farms, supporting people, making strong connections. And another thing, I got a chance to travel around the Ohio, Indianapolis. I visited so many places while at Ohio, and I enjoyed my friend's company called, her name is Darwin. She's Chinese. She really helped me live a good life in the US. She took me everywhere. She took me for sports, shopping. She took me everywhere, and I was so happy. I don't know how I could live my life without her in the US.
After participating in this fellowship, whenever I get to know anything that is happening in this planet, for example, you know that nowadays we had the outbreak of Ebola in our neighboring country, Democratic Republic of Congo. So from One Health Fellowship, I got to learn that tackling this issue does not only require the Ministry of Health, but there is a need for a collaboration of different ministries, different institutions, because the effect of this outbreak, it does not occur on one side, but it is felt by everyone. So there's a need for collaboration, a multidisciplinary approach in order to cut down the spread of this Ebola virus. What I can't forget is the is the fact that my mentor, Catherine Woodbrooks, had ducks that were living in the very nearby Assumption College. So whenever we could go shopping or going to church, we could pass by and we feed these ducks. So it was something that that had touched me in that it showed me how human beings can also be friendly to the animal, and then they also become friends to you. So whenever I make my memory back to think about that experience, it's something I cannot forget.
One helpful fellowship for me has been an opportunity to open my horizon and to break the borders of my discipline, because I'm trained in dental therapy, and oral health has been considered as an isolated health discipline. So participating in a One Health Fellowship helped me to break that border and then get connected to different disciplines. As you know, I was being trained together with people who has the background in environmental science, people have a background in health communication, and others. So that has been a great opportunity for me to interact with them, and also I was happy to get training and One Health leadership and advocacy. A great point that I liked, because if you wanted to work with different disciplines, you need a certain kind of leadership. Leadership that will train you on how to communicate cross disciplines, and also how you can advocate if there is a rising public health challenge. How will you advocate for it? How will you present it to others? And how you will propose solutions for that issue? So One Health leadership and advocacy was one reason that I learned and that I'm going to use in my future.
I learned a lot. As I said, I was exposed to different One Health diseases, related diseases, how they manage them, and the knowledge and skills that I got, I will use them in my future. Even I have started, in whatever I do, I apply One Health approach. And also the culture there, now I'm culture competent. I know how to deal with new cultures, especially US, because I was exposed to the US culture, and many other soft and hard skills that I got there will really help me to develop in my future.
I learned a lot from different lecturers we had from different universities, and I realized that things are somehow connected. And from there, I have been using it to actually identify key players in my environment that could help me in actually achieving my projects. Yes, it did help me build networks. One of my mentor, she introduced me to a lot of people, the people from CDC, and I still have contacts with them, and whenever I'm doing my projects and I need some assistance in understanding things, I actually get in contact with them, and they help me.
Before joining this program, I wasn't very, very much familiar with what One Health really was. But I am so very grateful, and I felt like I had a very invigorating experience with just being a One Health fellow, because I got to see the interconnection of the whole triad of human side and then animal side and the environmental side. And I see how like in the future or even now, there's a lot of interdependence between the three, And so I would say that I was much more able to connect the three components of One Health, and which I think as a future public health advocate, I plan to use towards my approach to resolve health issues in terms of promoting equitable health care services to everyone regardless of their backgrounds, and also challenging the pre-existing policies.
I definitely have to share the knowledge I got from there. One is through advocacy of how do people understand One Health? How do I increase awareness of One Health? How do I explain to people that we need the One Health approach in our daily activities, especially when it comes to emerging pandemic threats? When you are shaping the future workforce. So I'm so lucky because I belong to a university which has got a school, student association, which is One Health Club. That club, I will support them as a mentor, and also I'll work with them to I'll raise awareness in the community around, and also maybe I will extend it, not awareness, maybe to go into policy. What do we need to, how do we influence policy using One Health approach? Yeah, I visited Niagara Falls. That was beautiful. You see the water falling like 100 meters deep, and you see Canada and people visiting there. And I also went to New York, and I also visited Boston, and I can't forget the beautiful environment of Grafton's. There are a lot of forest and some wild animals. So to see some wild animals in my neighborhood.
Before I went to One Health program, I have to say that like One Health was something new to me. But nowadays, since I participate in One Health program, fellowship, now I have like a strong understanding of what is One Health. And the multidisciplinary collaboration is very key. So now in my daily work, I work with other people from different fields so that I make sure I use the holistic approach to solve different global health challenges. And also those connections I made when I was in the United States during the One Health Fellowship program, they are really very important in my current work because, as I said, we are doing some researches which are related to health, and that is something important which the whole country will benefit from.
I miss everything. Like I miss that green environment. It was wow, on point. And I miss you know, in Rwanda we are not used to like taking cabs, Uber and all that. Life was easy there. I was always like taking Uber to go from place to places, but here it's jump on a motor, go there. So like I miss that kind of, let me call it a classic life. So it was really fun. I will miss it all the time. I want to thank people who gave us chance to go and learn out there, bring skills, bring them back to our country and start actually serving our countries. Because currently we are all working on our follow-on projects. We are creating impacts in our communities. So I cannot end my speech without like expressing my sincere gratitude to the One Health team that has allowed us to contribute to the community well-being and improving animal, human, and environmental health.
Yeah, I miss some friends that had made an Assumption College, and also I miss the environment anyway, because by the time we were there, it was a good environment. It was not winter, it was like spring, so the environment was good. I miss the greenish, which was there by the time we were in the US.
Currently, I'm missing different things, but among them include the type of food that I was eating in the US, so I eat in Rwanda. So among those include lobsters, and oysters. So those are foods that are not easy to get familiar with, and sometimes it may be challenging when you ask a menu and they present you a menu and you find that you don't know them. But it's a great experience that as someone who is trained and who wants to live in one world. What I can say more is that I wanted to thank the leaders of One Health Fellowship. This was a great program and needed especially for young generation. So as you see, there are different diseases that are occurring. You know, the current coronavirus disease, which is shaking the world. As you can see, it's a disease that doesn't have borders. So as long as we have borders in our disciplines, it will be hard for us to tackle those current diseases. Thank you.
Oh, I miss a lot. I miss people from there. I miss people. and the place too.
I would say I'm missing the roads, the bridges, because the infrastructure back in the USA is very impressive. Thank you for introducing me to One Health, and I can promise you that I'm going to be using what I have learned from One Health and actually do it in impacting my community here in Rwanda.
One thing I would say that I miss is just like, it's very obvious there to see the change being caused by the global warming when you're up there. And honestly, I would go back. Like, I would go back. If I think about going back, I would definitely go back if the opportunity presents. I'm very thankful for the organizers because it was a great opportunity for me to learn from, and that's going to definitely benefit my future long-term career goals. And it's going to help me. I'm definitely going to use it in my approach to help people as they address their health issues, and also while I promote the healthcare services to everyone regardless of the backgrounds. Well, I'm just very happy that I was able to be part of this program.
You know, I miss the climate there. And I also miss the friends I met there, and I miss how people are organized, the way they work, and the lab they have there, and everything they have is like they have pre-planned. I wish to have more people going on the other side, and the US student coming here, because there's a lot to learn from both sides, and which will make like One Health program sustainable.